All right, welcome back. Well, we just had a great talk on tremor shakes, and I thought Dr. Dickey gave us some great information. So let me go into the audience. We had a few questions. Ma'am, I saw you raise your hand. What's your name?
Iona Monroe.
Miss Monroe, what's your question? Nice to meet you.
Nice to meet you too.
What's your question?
My question is, would restless legs be a part of the tremor family?
Oh, great question. Restless legs, Dr. Dickey. What about that restless leg?
That's a very good question. Restless legs is actually a different disease category, and certain things can cause restless legs to be worse. Actually, one of the most interesting things is low levels of iron is one of the first things that your doctor should probably check if you're having symptoms of restless legs.
But kind of similar because it's a movement, but it's not a tremor. Restless legs, we're hearing more and more about. Does anybody have experience with restless legs, meaning your legs sort of jerk around, particularly at night when you go to bed? Yeah, that's a good question. Thank you, Ms. Monroe. Let me go over here to this gentleman. I saw you raising your hand. What's your name, sir?
My name is Mike Bulao.
Nice to meet you. What's your
Thank
question?
you. My question is, speaking about restless legs, I go to the gym every 3 times a week, and at night I have some kind of a pressure pain in my left leg, and it's really, really painful. So what causes it?
Is it like a cramp kind of
Yeah,
pain? Like a
uh-huh.
cramp. Well, first of all, let's give Mike a round of applause for the gym 3 times a week. What about that, huh?
Thank you.
Okay. But I guess sometimes in the middle of the night particularly, you're getting some cramps in the muscles of your legs. What about that, Dr.?
Now, when you get the cramps, do you feel like you absolutely have to move your leg right away? Does it make you?
Right away, yes.
Okay, so that is more along the line of a restless leg type disorder. And whether it's related to the gym or not, it's really hard to say. But one of the first things you did if you came to see me in the clinic is I would probably check your iron level, and we would go from there. Sometimes leg cramping and things like that can be a sign of a sleep disorder that you're having at night.
Sometimes we will see also, and this tends to be worse in the elderly, what we call nocturnal cramps or cramps in the middle of the night. Exercise can make that worse. Not drinking enough liquids. So I'm talking about like a Charlie horse. You ever get like a muscle that cramps up and it curls your toes? And not drinking enough liquids can make that worse. We used to use a medicine, an old medicine called quinine, but you can't get it anymore. It works pretty good. We don't really know what causes these things, but certainly drinking a lot, being careful not to overdo it with exercise, warming up and stretching. But Dr. Gott, you all know about Dr. Gott, he says put a bar of soap under the sheets. And he says that helps. It certainly doesn't hurt, so I tell patients to try it, a bar of soap under the sheets. Who uses a bar?
I did.
Tell me about that.
I couldn't turn over in the bed, died. I was hollering. Cramps in my legs and my toes and everything. I had to try to jump up out of the bed.
And what do you do with the soap?
I put it on my pad on my mattress, and I laid there, and it's still there. I don't move it.
Under your leg.
Yeah, and I don't have them cramps no more.
There you go. Now, any particular kind of soap?
No.
Any kind.
I just put it under there.
All right, good. I like it. I like it. That's a harmless, cheap way to treat those cramps. One last question. What's your name?
Rosa Watson.
Miss Watson. What's your question?
I want to know if your brain wave pattern or your wave of thought, is it related to tremors, you know?
Okay, so is there something in the brain or brain waves that's related to tremors? That's a great question, too.
Yeah. Now, as we said before, the different types of tremors have different sort of pathology in the brain that's relating to them. Now, the intention tremor is the one that we know the most about. That, many strokes can cause this type of tremor. The actual essential tremor that happens at rest, we're not really sure what causes it. There's a lot of theories, and similar to the theories that cause Parkinsonism, there's areas in the brain which are responsible for movement. So abnormalities in these areas can cause abnormal movements. The cerebellum is a major area, and the basal ganglia in the brain are both areas that can cause this. That's why I didn't elaborate it before, but if some of these medications aren't working, and the tremor is really affecting your daily life, we can kind of step it up a little bit, and some people are actually performing surgeries to eliminate tremors, and it includes brain surgery, basically, where they're either ablating certain areas or they're stimulating certain areas with electricity.
So it is related to the brain. And then it makes me think, your question makes me think of another kind of movement shaken seizures or convulsions that's related to brain waves, but that's different from tremors too. So there are several of these movement problems that are brain related but all separate. And that's why it's important to see an expert like Dr. Dickey or your good doctor if you have questions or you get some of these symptoms. Well, those are great questions, audience. Thanks for joining us. And come back and see us next month for another edition of What's Up, Doc. Thanks to Dr. Dickey for joining us.